another new edition of Windows on Current Affairs, and today we also continue to talk about the government's continuous efforts to be able to provide precautionary measures and spread awareness and take its own precautionary measures to protect its citizens, and including, of course, providing vaccines and talking about the other medical measures that are supposed to be taken in the coming phase. And we're very delighted to be having with us Dr. Magdy Adly, is Inspector at Health Insurance Department at the Ministry of Health. And good evening, Dr. Adly.
Good evening. I appreciate to be with you, and good evening for all your followers, all who are watching us now. And I'm so happy to be with you tonight.
Same here, Dr. Adly. Before we start off talking at the precaution measures, because this is a very, very important edition for all of us, let us talk about that mega project that was launched by the President, where he was seen earlier having a concerned meeting with the Minister of Health and the chairman of one of the companies, to our knowledge, and talking about the plasma derivatives, which is very, very important for the people who are suffering from hemophilia. Talk to us, how important is that project, and what exactly is that project going to provide for those particular people with hemophilia?
Good evening, and I'd like to say something very important. Here in Egypt we have a political leadership caring very well with the citizen health, and both citizen health in the first degree and first class. Before anything, before any
first priority.
Yes, first priority, even before any financial priorities. Like what happened this week for the national mega project, like that plasma derivatives production, which was a dream for like 3 million people, including children who are taking medicine for hemophilia. That which was the plasma derivatives production, and this project mainly was costing a country like $500 billion yearly. We make a negotiation with these mother company of that plasma derivatives, which is a Spanish company, and we will try to produce these derivatives, which is very important for these people in a very soon time. This leads us to the leadership is concerning and caring very well with citizen health, and that leads us to say when the vaccine even of COVID-19 will be available. Egypt will be from the first countries which can take that vaccine, and I think by the beginning or by 6 of 2021 we will have a vaccine in a large scale, and every Egyptian every Egyptian citizen will take that vaccine to protect it from coronavirus. But today I am coming to say something very important. Country and political leadership doesn't following everything day by day, minute by minute for the health. But we as a citizen, we're supposed to have a community awareness.
Of course, we're going to talk about the community awareness and everything, but let us first explain to the viewers the difference or the common factors between flu, a normal flu, and the COVID-19. Because some people, not some people, normally with that time of the year, you could have a sore throat, you could be a little bit, have some temperature, or you could be a little bit exhausted, you could be sneezing, or you could have some of the symptoms. I know COVID-19 doesn't come with sneezing, but it comes with throat, and it comes with difficulty in breathing. Sometimes you could have a common flu and you could have difficulty in...
That's right, that's right. But I'd like to say something which is very important and makes people hear it for the first time. Anybody feeling with that symptoms which I will say now, he's supposed to go direct to make analysis and make CT scan for chest CT scan and isolate himself till the results is come out, which is one, having a fever with sore throat, having a headache, having a dry cough, having a hardness in breathing, and the new symptoms of COVID-19, by the way, because there is a new symptoms of COVID-19 which appear these days. You know, COVID-19 is coming through the upper respiratory system, through noise and the mouth and the eyes, but these days they discovered it come also with GIT system, because GIT system or digestive system having the same receptors for that COVID-19 like nose and like mouth. But these wave, it can make symptoms which show that this symptoms is COVID-19, which is what? Like diarrhea and something with colon disorders and even vomiting. If you have a headache or fever with a diarrhea or with some abdomen or colon disorders, you are suspected to be a COVID-19 patient.
So if I have diarrhea and if I have colon disorder,
yes,
but there are half of the population, half of the population are suffering from colon disorder.
Okay, I
but
told
with
you,
fever, it should be accompanied by fever.
Combined with fever and the headache.
So fever and the headache are the first symptoms.
Yes.
If it is accompanied by colon disorder
or
vomiting,
or diarrhea or vomiting, these are the new symptoms of COVID-19.
yes.
So that you're supposed to hurry up and make analysis, make chest X-ray, so that we can compete or we can contain the virus from the beginning. Because we supposed to know that Egypt, by the way, having a good experience right now, because we have that pandemic since 11 months ago. So we have enough experience, and we have a very clever doctors or team, medical team that can deal with that pandemic. And by the way, Egypt, one of the countries which not hurted a lot from that COVID-19.
Was not affected by that pandemic. But then also, you can correct me if I'm wrong, we heard about other people who had who were infected by the pandemic and there were no symptoms shown at all. They didn't suffer from any symptoms, but
That-
then they discovered that they were positive.
I said that before.
Right.
They classified people in 4 classes: A class, B class, C class, D class.
That is a very important stop. But we need to hold here because we have Dr. Muhammad Anwar, Dr. Muhammad Anwar over the phone, and he's a professor at medical university, medical department at one of the prominent universities in Egypt. And but please, you have to remember the 4 classifications,
yes.
because it's very important.
This is very nice.
Dr. Muhammad Anwar is with us over the line, and he's live. Good evening, Dr. Anwar.
Good evening.
As you have heard, we were talking about different elements and different important stops when we are investigating the new COVID-19 that is prevailing worldwide, by the way, but didn't show that much in Egypt. I mean, Egypt is one of the rare countries that do not show that much of symptoms or infections. Very, very small scale of infections. But let us first talk about the symptoms, as we were talking with Dr. Adly, and he was talking about different symptoms for the new COVID-19 that prevailed in Europe and in the United States and Spain. But I was telling him also that with the new COVID-19, some infections did not register any symptoms at all. So, what is the story?
In some cases also without fever.
Without fever?
Yeah.
Without fever. So, if you could explain to us, please, because probably not so many people from our viewers or even from us are not aware of the new symptoms. I mean, because it is always a very active, the pandemic, and it's always evolving, and it's always in continuous change.
Yeah, it's a strange virus. This virus affects more than one system of the body, and we haven't seen viruses like this. It affects the respiratory system, the gastrointestinal system, and the vascular system as thrombosis. There are different strains of the virus, and the virus is changing themselves from time to time. Thank God, in Egypt, we have not seen much cases. Now, up to this moment, we have 60.6 million victims of coronavirus. 38.9 are cured. And 1,000,045, that's 1,450,000 are dead. They are dead already.
Yes.
So in Egypt, I think the immunity of the Egyptian people are stronger than others.
Thanks to God.
You know, yeah,
Touch wood.
because the strain of the virus, maybe it's not like that in the United States or Spain or something. There's some papers about the BCG vaccine, the tuberculosis vaccine. They are not taking it in Europe and America, but it's compulsory in Egypt to get the BCG vaccine. It gives cross immunity. And above all, the efforts of our governments and our Minister of Health and the whole crisis team, and above all, it's God. Yeah, thanks God that we have not seen much cases like in Europe or United States.
I need to ask you a question, get in here and ask you another important question. How do you justify that much, I mean, that too many numbers, I mean, too many people got infected, I mean, that huge numbers of infection inside the United States, in spite of the fact that it's one of the most leading countries when it comes to precautionary measures, to awareness, not really awareness in the United States, but a power country.
Yeah, it's maybe they are more high technological, the healthcare system is much better than the other countries.
Exactly.
But the people themselves are not wearing masks.
Exactly.
We have seen many strikes and many what happened. They are not. There is no social distances there, and they are not convinced of hand wash. And many of them now, they are against the vaccine.
They are against vaccine.
Yeah,
Because Okay, go ahead. Go ahead.
So that's why it spreads rapidly in the United States.
Right, but because the reason I'm asking you that, because when we know the reason behind the numbers of infection that are on the rise in some countries, that would maybe signify for us the factors for the spread of that infection, other than washing hands and other things. I mean, there might be some common factor between those countries who are on the rise when it comes to infection.
Yeah, when it comes to infection, you know, you can touch any surface, and if anyone is infected, touch that surface, and then you touch that surface, and you
rub my eyes.
Your hand is transmitting it to your nose. And the best thing that your hand must forget your face.
Or I wear gloves.
This is the best thing. Forget about touching your face with your hand.
Right.
That's why we are insisting upon hand wash for 20
hand wash
seconds.
Is the best thing. Soap and water, and next to it is alcohol.
Or alcohol-based rub.
But soap and water first. We need to spread awareness about those conceptions to people, because some people are at home and they don't even care to wash their hands. They say I'm using alcohol. They do not know. Nobody have explained enough to them that soap and water is the #1 precautionary measure before anything else.
And you know the statistics. The most common cases are housewives and old people that are not going outside. These are the statistics in Egypt.
Why?
Yeah, because their sons and daughters come and hug them or something, transmitting the disease. The house cleaner maybe transmit them to the disease, but it's not necessary to go out to get infected.
Or they can come and shop from groceries and they do not watch the shopping bags or the grocery itself enough for 19 times or 20 times, which could be like...
it's as simple as that. If you touch a surface that's infected with the virus, you will get the virus.
What exact time should I suppose...
near your face, you will get the virus.
Come again, please?
If you touch any surface that is infected by the virus, or touch it by one who is infected by the virus, and then your hand comes near your nose or in your mouth or even your eye. You know, the first one who discovered COVID, he's a Chinese ophthalmologist, and who died with COVID.
Exactly. 2 people.
Yeah.
Exactly. Right. But tell me the exact time that I'm supposed to be washing my hands or the grocery. It's not only the matter of washing, but else over that I should be washing it for like about 19 seconds? Or 20 seconds?
This is a CDC recommendation. You have to wash your hands for 20 seconds with
20
soap and
seconds.
water. Or alcohol-based rub until it is dried.
I should?
Alcohol-based rub or any hand sanitizers that
until
effective
it's dry.
against the coronavirus, yeah. Alcohol, of course, that's the most common, and
right, of course, but
70% concentration.
Or otherwise, there should be, because alcohol might not be to the reach of most of the people. So soap and water would be much better, only if they know, because people would say, I just washed my hands, especially children. I just washed my hands only for 3 seconds. They should be counting from 1 to 20 when they wash their hands.
If you touch the money or touch the surface,
of course,
any surface or anything, you have to wash your hands.
Or I sanitize the money.
So sanitize them.
Thank you so much, Dr. Muhammad Anwar. You are a professor of medicine at the Faculty of Medicine. Thank you so much.
I'd like to add something for what Victor said. First of all, 60 of infected cases in Egypt was these people who are in closed places.
Of course.
Like,
no ventilation.
Yes, no ventilation and no fresh air, so that the concentration of the virus is very high. But people who are on the street, who are taking a sun, the sun increase their immunity. Because you know sun increase the vitamin D in the body. And for the sanitizers, even they sanitizers including alcohol and soap. Sometimes some people said we have hypersensitivity of alcohol and of any others sanitizers. For people who having hypersensitivity of alcohols, they can, or chlorine, they can use something called hydrogen peroxide. Hydrogen peroxide with a concentration of...
It's like oxygen.
Yes, but in a concentration of 3% only. That will kill the virus.
It will kill their skin also at the same time.
No, 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 no. 3%. The one you buy from the pharmacy is 10%, 20%, 30%. But I talk about 3%. Hydrogen peroxide is enough to kill the virus if you have a hypersensitivity of alcohol or chlorine.
Or I can wipe the surfaces.
Yes, this.
If I'm wiping the surface, can I use more concentration?
Yes, for services.
How much of a concentration?
Even the little concentration to kill the virus is 3% for skins. But if for any surface, you can even use 10%.
I forgot to ask you a very important question. Before the first COVID or the first wave, we used to say that, yes, of course, I have to mind or take my precautionary measures when touching anything, inhaling anything, communicating at a very close distance, and all that, eating ice cream and drinking cold beverages and everything. But when it comes to food, hot meal, it's okay. What about the second wave? You said, you talked about the stomach.
Second
Is
wave,
it going to be, we should take precautionary measures when it comes to food?
You're supposed not to eat outside, outdoor.
But they said when food comes into your stomach, it will be digested.
Yes, I know, but
the virus, the
outdoor, the percent to be infected with the virus is very high. So you're supposed not to eat outdoor totally.
Exactly, in the sense of being to be situated outdoor. But I'm talking about delivery, about the food itself.
Yes,
buying food from outside. How dangerous is it?
You mean delivery?
Not delivery. If I'm eating, if I'm buying roasted chicken from outside and I bring it home and I eat. I mean,
no problem. If you make cooking at home, no problem.
No, but I'm not talking about cooking at home.
If you bring it out from outside, but
falafel, full and falafel,
yes,
sandwiches.
But you're supposed to be sure that the bags, which is coming with from outside, is very clear, and you can wear a gloves. Once you can take the
of course the bag, the
food,
paper
and
is
then
infected.
you get it out.
Exactly, but my question is targeting the evolution of the virus itself. The food, is it remaining the same? Even if with the existence of all the pandemic and the rise and everything worldwide, the food, when it comes to my stomach, even if it has corona from someone who touched it,
it
will be digested?
There is difference now. I get what you need. The stomach have an acid which is HCl, can kill any virus or anything, but in the case of coronavirus, it catch the receptors of GIT.
And what's that?
Okay, the digestive system is starting from the mouth direct to then to the esophagus, then stomach, then intestine, and so on. He can catch the receptors before come to the stomach.
The esophagus.
Yes. there is a receptors of that of COVID in that space. But once it comes to the stomach, the HCl of the stomach can
Digest it.
Yes, digest
So it's
it.
safe.
It's safe, but
So all hot food, hot meals are safe.
hot, well, come on, well cooked.
So pizzas are not safe.
I say well cooked food is okay.
So that means that pastries and pizzas and
Yes, which
sandwiches
these-
are not safe.
Yes, anything which is not completely cooked very carefully.
It's 60 centigrade.
Yes, is not.
But then you said that when it
which
comes
is called
into my
the
stomach, it will be
luncheon and-
digested, which is the HCl.
luncheon and something is very harmful, by the way.
It's harmful anyway, since we
Yes.
were, because it's not healthy at all eating the cold cuts. But I'm talking about, you said that whatever the food is, when it comes into my stomach, it is digested and killed by the HCl.
Yes, but I told you the virus can catch the receptors before enter to the stomach, so that it make symptoms of that COVID-19 before come to the stomach.
And it might disperse to other parts of the body?
Yes, so that you suppose to drink a hot
beverages.
So that you can push the virus even to the stomach. Once it comes to the stomach, the acid of the stomach can digest it easily.
What about precautionary measures, the home remedies, good old-fashioned home remedies like the lemon, the very hot water, the vinegar, the salt, and stirring them all, mixing them together and gargling? Is it okay?
This is very nice, but it's not a way to prevent the symptoms of COVID. It
Does not kill the virus when
not
it's
kill
stuck?
the virus, but can
Weaken it.
Yes, treat the light symptoms if your immune system is okay. The problem is that when the virus come to the body, it start as a normal flu with a little symptoms. If you deal with it starting of zero moment, starting from zero moment, with a hot beverage, with lemon, with vitamins, with exposure to the sun, that will help very nice to help the the virus to be killed, and there is no more severe symptoms. But if you take it as a normal flu and doesn't take your
We don't take it
precautionary-
seriously
yes,
enough, it's
seriously
going to
enough,
exaggerate.
it's come to the second phase, which is very harmful when the virus come to the lung. Even the treatment or protocol of treatment classified the treatment of virus into two phases. One phase is the beginning of the virus, and the second phase is when the virus comes to the lung. Medication of the phase 1 is not like medication
for
of
the
phase 2.
other serious part. This
Okay.
we know about it, but also we need to talk about something that should be spread. I mean, with clarity and too many times to the viewers and the people and citizens. The isolation. Let's say that someone is infected. I mean, a school student like Dr. Anwar said, he came and there is a grandma who is over 80 or 70 something, and
Yes.
she's staying at home, and I'm infected, or my son is infected, or my younger sister is infected, and it's only a small apartment. I mean, how do we deal, like the isolation and the usage of bathrooms and the kitchen and the utilities, and how do we handle
look,
this?
my brother. Look, my sister. Hey, there is if you have an elderly people with your in your house, and you have a children in the same time, these children go to school and come back. you're supposed to keep a social distance very big between them. If you find a way to isolate these, the problem is the elderly people,
We're
not
talking
the
about
children.
elderly people.
The
Even if
children,
I'm keeping distance, but they're using the same coffee table, the
Yeah.
same, or they're sitting, you entering the same
that
rooms.
leads us to how to clean and sterile the house every hour.
Every hour. So they can stay with each other if
They
someone
can
is having
stay, but
COVID?
they can have the high scale of precautional measurement, like wearing a mask, even at home.
Ah, okay.
Wearing a mask, cleaning the table with chlorine or alcohol, and using sensitizers every 15 minutes, washing with a soap. Once the children or the kids come from the school direct to the to home, he's supposed to go to the bathroom and wash his hand very carefully, and his shoes out of the flat. That give you like 80% of safety.
What if there is a patient? No, I'm talking about another case. If there is already a patient inside the house and we have to nurse him, and there is an elderly.
No, this is we can't make an elderly people in a flat containing an infected case.
We cannot. They cannot stay with each other.
Yes, and
Too
it
bad.
depends on even these people having a chronic disease like diabetic people or like hypertensive people. That will be a problem if they take
It will be very
COVID-19.
dangerous. If you can excuse me, with us right now, Dr. Jamila Nasr, and she's a professor at the Faculty of Medicine at Suez Canal University. Good evening, Dr. Nasr.
Hello, good evening.
Hello.
You hear me?
How are you doing, ma'am?
You hear me? You hear me? Hello, good evening.
Good evening,
Hello.
ma'am.
Good evening. Hello.
Hello.
Hello, good evening. How are you?
I'm fine. Thank you so much.
Fine.
We were
Thank
talking. We were talking about the different cases. If you could, lower the volume of the TV and you could use the phone receiver or use the phone only when communicating.
Okay, I'm just using the phone only. I'm not.
You're only
in front
using
of
the phone.
TV.
Okay.
Yes.
Okay.
Yes.
So we
Yes.
were talking about the precautionary measures. Of course, the symptoms, it's the doctor's part, but we as citizens talking about the precautionary measures and the awareness in general. We were talking, Dr. Adly, about precautionary measures. We were talking also about the isolation. Some people, most of the people, low income bracket, they have very small, they live in small apartments. Some of them is infected and they have an elderly person there. So Dr. Adly said it's impossible that you keep elderly person in a house where there is an infected person, right?
Yes, that's true. I think this is very important. When you're talking about COVID-19. Actually, maybe we are having a second peak of starting the second peak of COVID-19, and this is all we need to know is just to increase our immunity. So the immunity is very important, especially in the mild cases, because all you have to do is just viral infection. So you have to increase your immunity by having, personal hygiene, keeping social distancing, cleanly wash your hands, in a perfect way, not less than 20 seconds at a time. Exactly, social distance. You just wear the mask. Wearing the mask is very important.
Dr. Jamila, because we have very little time, what about elderly people going out to be able to run errands, to maybe going to their jobs? Elderly people going to supermarkets, going to clubs.
If he's going and he's not in a crowded a crowded area, he can go and he can walk, but he should take ample amounts of sleep. But actually, if he's moving in a crowded area, this will be not very good at all. So it's better to stay at home. So far, there is no total lockdown.
There
So
is?
far, there is no total lockdown now in
Okay.
Egypt. Luckily, this is very good so far, and we hope this will not occur again. So maybe you have to go to work, but you should, sleep well, avoid, avoid to be in a crowded area, and you should just, as you have said earlier in your talk, that you should be having the precautionary measures. It's very important.
Right.
So prevention, we're talking about prevention. So you should prevent the occurrence, much more important than treating the corona.
Right.
And we have, luckily, we have many cases which is rather mild. It is not very, difficult cases. Many cases not needing ventilation, and maybe some, very mild cases. Maybe the patient shouldn't be needed to be in ventilator. This is fine. They just needed to be isolated only.
Right. Dr. Gamila Nasr, you're a professor at the Faculty of Medicine at the Suez Canal University. Thank you so much, ma'am. You have a good night.
Dr. Gamila said something which is very good, which is the partial lockdown. By the way, somebody asked why the number in Egypt is not increased so much like the other countries.
Why?
You know, there is some reasons that keep the cases in Egypt is not increased so far. One of them is BCG vaccine, which is given to the kids or children. Other countries like America and Europe doesn't take BCG vaccine.
That's true.
Second, these countries make a total or completely lockdown. Then they delete that lockdown suddenly. People go out. They don't exposure to even a little viral load infection. By the way, when you make partial lockdown, you keep community exposure to a little viral load infection. Even when you wearing a mask, if you infected and you wearing a mask is not like infected without a mask.
How different is that?
The difference is when the mask decrease the viral load of infection, so that you just keep the viral.
Oh my God! So it looks like, in other words, you're trying to say that in some infections, I mean, like other disease, I become a carrier.
Yes, and
only a carrier, and it's like immuning me.
It depends on the viral load, the quantity of the virus which come to the body. If that quantity is very small,
it's good.
It's good. This is a good.
So I become a carrier, and it's like I'm taking a vaccine.
You will create an antibodies against it.
Yes, exactly.
And you don't
like toxoplasmosis, for example.
Yes, that's right. But when you make a completely
when you isolate
lockdown,
myself from toxoplasmosis entirely, and I face and I eat like raw meat or sushi or something, I become infected with toxoplasmosis.
You will be a very delicious meat for the virus. You understand me?
Yes, I'll be a prey, a good prey.
Yes, this is right. So that when we make the partial lockdown, it was a very genius idea.
And can I add something? When we are making a complete lockdown or any lockdown, I mean, we tried the lockdown and the curfew and everything. Even we tried the curfew last year. The curfew is escalating. It escalates the people rushing to their homes at one time, all at one time, and it escalates the rush.
Curfew, they find that curfew, total or completely curfew, is very harmful.
Very harmful.
One, financially, this is exactly is harmful. Secondly, they keep the overcrowding at home and you're staying a lot. The problem is the time you are staying in a closed area. When you stay a long time in a closed area, you are suspected to be infected.
Even
Okay.
from inside, indoors?
Yes, not I talk about groups, not a single, even
large
indoors.
families,
Yes, but when you stay in any place for a little time, even that place having a lot of individuals, you are not suspected to be infected. The factor here is
So
the
even
time.
when we are at home, we should be keeping distance. We should not be staying all in groups or anything.
Yes, because as I told you, the classification A, B, C, D.
We haven't
A,
talked about it.
yes.
We have like 3 minutes. Can you
Okay,
please?
A is, I wish that we would like to talk about the new news about the novel news about the vaccine, but I will.
It's okay. Next
be
time,
fast.
inshallah, if you promise us to come, we can talk about the new vaccine.
A is an infected case. B, I will is the one who are contact to infected case, but he doesn't know that he is infected. C is that one who are carrier of the virus, not having a symptoms, asymptomatic. D is a normal one. The very dangerous class is B, because B is asymptomatic, doesn't have fever, doesn't have cough, doesn't have any symptoms of COVID, and doesn't know that he have COVID.
Very dangerous.
Very dangerous. So this one is all the planes in countries are targeting that class.
And the
which
government is sparing every effort
yes.
to be able to take its utmost precautionary measures, and this is showing to the whole world, because it's a
Yes.
hell of a difference.
Uh-huh.
Unfortunately, we ran out of time.
Thank
but
you,
on a
and,
promise from you that you will come next
no
time and
problem.
talk to us.
No problem.
Dr. Magdy Adly,
Thank
your
you.
inspector at Health Insurance Department, Ministry of Health. Thank you so much
I'm so
for this valuable information.
I'm so
And
happy to be with you
may
tonight.
God bless Egypt and its citizens.
God bless Egypt.
And its administration. And I guess this brings us to the end of this edition of Windows and Current Affairs. Many thanks to all of you. Until we see you again next week, that's a goodbye. Be safe.